I'm Mike Royer with an extended interview in this Health Matters Web Extra. Welcome to another segment of Health Matters. My name is Mike Royer, and a familiar face is our guest today, Dr. James Reeves, a psychiatrist at University Medical Center here at the University of Alabama, with us a few times before, and it's good to see you again.
Thanks for having me back.
I've got family members that suffer from dementia. I imagine you do. I imagine most of our viewers know or have family members that deal with dementia. Living longer, as most folks are doing, comes with this one downside, doesn't it?
Absolutely. Yes, sir. The baby boom population that's getting old right now, one of the biggest populations we've had, is getting into that age where they're getting into their 70s and so forth. And that's what we're seeing a lot more now, is dementia being diagnosed much more commonly than it was in the past as people enter that age group.
And if you're outlining our topic today, dementia is a name that would come above a variety of different forms of the problem. Dementia would be a kind of a heading, is that right?
Absolutely, yeah. Dementia is commonly thought of as Alzheimer's disease. People, when they hear Alzheimer's, they think dementia. But as you said, dementia is actually a broad category. It encompasses all sorts of different types of dementia. Alzheimer's, probably about 70–90% of dementia could be Alzheimer's, which is why the two are together. But dementia could be caused by a variety of things. Otherwise called vascular dementia, which is a type of dementia caused by strokes, little mini strokes that occur and accumulate over time. And people who have Parkinson's develop something called Lewy body dementia, which is also a type of dementia that looks similar to Alzheimer's. And there's a variety of other things, from reversible things such as alcohol and vitamin deficiencies that cause dementia to a lot of other non-reversible types.
You mentioned Lewy body, so I'll follow up on that. A very public case of that was the comedian Robin Williams. That's what he had and killed himself. That particular one is especially difficult because I understand patients see things and have visions and really have some confusing episodes to deal with.
Yes, visual hallucinations are not uncommon in the Lewy body dementia. All types of dementia, when they get to be serious in terms of the severe forms, can have certain types of hallucinations, visual and auditory, but Lewy body is known for the visual hallucination component to it. And plus, people have other motor components. They can't move as well, they can't feel as well, they can't talk as well, and so forth, and that just further worsens the dementia.
For folks who are moving through their 60s, maybe early into their 70s, and they find that they are a little bit forgetful, they forget names, that might be okay and maybe wouldn't be officially diagnosed as dementia. Is it just the beginnings of just slowing up a bit? Where do you draw the line between forgetfulness a little bit, and I'm afraid we have some dementia issues?
Absolutely. Our brains, as they get older, may not function as efficiently as they did when we were in our teens and so forth. And that's not uncommon to have that kind of senior moment, as some people call it, where you can't remember someone's name or you can't remember something that you did recently. And that's all normal. That's all to be expected. Some people are very sharp, other people have these senior moments. And that's on the normal side of things. You still live your life fine, but you may have these moments. Then there's something called mild cognitive impairment, which is a little bit more of those senior moments, where it starts to impact things a little bit more, causing some disruptions. And then you get into dementia, which is where that becomes more severe and becomes more dysfunctional in terms of your life, unable to perform at a job or having troubles doing things around the house and things like that. So there's a spectrum from normal kind of aging to this dementia with mild cognitive impairment in between.
You have years of experience as a doctor, as a psychiatrist. Are you, these days, with the technology you have and the knowledge you have, to be able to draw those lines and in a pretty short order diagnose whether someone is truly having an episode that is leading to more serious problems? Are you able to do that?
Absolutely, yeah. And so if you're someone who's getting older and you're noticing more and more of those types of memory lapses and problems, there are a lot of things that we can do. There's significant psychological testing we do to find out exactly the extent of those memory and cognitive problems. It's not just memory, but it's your ability to think through problems, work through issues, being able to perform certain activities that start to become affected, and testing can look at that. And we'll draw labs to find out if there's some reasons that are causing this that we can reverse, do scans of someone's head to find out if there's something else that could be a tumor or something else that could be causing that. So yeah, we undergo a variety of tests for someone who's really concerned about that. And a lot of times we can reassure people, what you're experiencing is nothing wrong with that. You know, you're have a normal brain and your lab tests are fine, and we watch that over time, and hopefully, you know, it stays in the mild form. But it's very common and natural to wonder and to be fearful that are you developing dementia as you start to notice these memory changes.
As an interviewer with no medical training, I always expect those of you that are smart doctors to have answers for everything. So what are the answers that you have for us for things we can do to maybe slow down or even prevent to some degree dementia in the people we care about and for ourselves too?
Absolutely. There's a whole lot of things being written about this now, a lot of books and stuff. As the baby boom generation gets older, you find a lot of people writing about this, how to have a healthy brain as you get into your 70s and 80s. And there's a lot of things that you can do, very simple things that people can do. Easy, the three things to remember are sleep well, exercise, and eat well. If you can do those three things, you can forestall a lot of those memory problems. And there's very easy ways to do that. 30 minutes of exercise 5 days a week is all you really need, and you don't need to go to the gym. Just go outside for a brisk walk that gets the brain flowing, or that gets the blood flowing into your brain, gets things moving, oxygen. And that's been shown to enhance memory. If you do that on a regular basis, you actually improve your memory by doing that. Eating a diet that's low in sugar. The more that we look at the impact of sugar on the brain, the more we see its toxic effects. And a lot of those memory problems you see as you get older can be reversed through eating a good diet with less sugar. You know, not drinking that fountain drink full of sugar every day and things like that, or orange juice. And so sleeping well is underrated. Your brain needs that 7 to 8 hours to clear those toxins out so it can function more efficiently. So there's some very simple things, routine things you can do without taking medication that can reverse a lot of this.
Give us your thoughts also on socialization. Being alone most of the time is not a good thing necessarily, is it?
That's one of the best things you can do in terms of socialization, because socialization does a lot of different things for your brain. Number one is actually requires you to think. By you and us having this conversation right now, I'm anticipating your questions. I'm wondering what I'm going to respond. My brain is thinking about the answer. It's going through all sorts of things right now. And that's what happens in a conversation with anyone that you have. And that is getting your brain moving. It's getting it working. Those muscle memory type things are coming into play with your brain. And it helps just with ability to relate to someone like that. That socialization part is reassuring. It's how we are as humans. We're meant to socialize. And that part of it emotionally is reassuring, as well as improving your brain functioning. So socialization is one of the best things you can do to kind of keep your brain working effectively.
Grandma Royer was born in 1900. She lived to be 86 years old, and I remember when she was in her 60s, and we thought, oh my goodness, she is so old. Grandma Royer won't be with us long. She worked crossword puzzles and said, Mike, this keeps my brain sharp. Grandma Royer knew what she was talking about to some degree, didn't she?
Absolutely, yeah. And that's a good point about puzzles and things like that. There's a lot of things that are marketed now to try to help your brain function better. One of the key things is you want to have your brain work on different types of things. So if you do the same thing over and over again, then it's like that muscle memory kicks in and it's not as effective. You want to be doing different things. Get your mind working in different ways. So like learning a language is something that gets your mind working in a different way. You're learning new words, learning how languages work. You know, try using your left hand one day. That'll get your brain working pretty hard as you're trying to think of using your left hand to do things. So it's those, maybe a crossword is great, but maybe the next day you do a Sudoku puzzle, and the next day you do a different type of puzzle. So it's always keeping your mind sharp by doing different things that really keeps things moving.
I wonder if viewers may have laughed along with me. I was trying to picture me doing writing or anything with my left hand. That would be a brain challenge for me, for sure. In closing, it's a blessing we're living longer, barring accident or serious illness, but at the same time we face memory challenges, dementia challenges, but there are some things to do about it, including seeing a professional like you for some guidance.
Absolutely, yes. And there's millions and millions of dollars put into research on Alzheimer's disease and all sorts of types of treatments. And so the earlier, if you have a real concern, or you have a relative who's real concerned, the earlier you get this looked at, the better. A lot of the treatments we have are for early stages that tend to work well. So yes, if that becomes an issue, please seek out some professional help.
Dr. James Reeves, you always supply a lot of great information for us. Thank you for joining us today, and we'll look forward to having you back on Health Matters. Thank you.
Thank you very much. Appreciate it.